Good morning and good afternoon to everyone out there. We have been MIA for a little while for summer vacation for our daughter. So we are happy to be back, and hopefully we can do this, continue to do this every week, Mondays at 11 a.m. Central Standard Time. And I'm excited about the topic today, and that's something that we are very passionate about as well. So stay tuned.
Welcome to the Live and Give Show with Dr. Jaime Gonzalez and Dr. Hua Nguyen. Join us as we share our experiences and those of other experts in their fields who've discovered financial security while creating a pathway towards giving back to others.
And I am joined by my lovely, beautiful wife, Hua Nguyen. Good morning, Dr. Nguyen.
Good morning. Good morning, everyone. Happy to have everyone join us this morning and catch you guys up. And this is a little different topic today. Tell them what we are discussing.
Yeah, so because I do get a lot of questions whenever we're out and about, either in conferences or real estate conventions, or just out and about, whenever people are watching the show and they ask us, hey, how about you guys talk about this and that? But I've had asked, a few people have asked me, I should say, how about just about the eyes, something that you guys have been, practicing for 18 years now, or going on 19
years,
19 years. And so
don't age us. Don't age us.
I'm 26. I became an eye doctor at 8. But yeah, I think eye care, I think we can do a good job at that. And we study a lot of technology in our practices, and we go to a bunch of conferences and stuff like that with eye care. And I'm very surprised on our patients that come in. They know very little about eyes and their eye care, actually just in general about health. And so we have to be there, educating them, not just about their eyes, but about their general health as well, because we see a lot of systemic disease that you can first see in the eyes. And that's a first look that we get to view a patient that, hasn't been maybe to a general doctor, primary care physician, probably in 2 or 3 years. And we can start seeing changes in the eye, because once we take a look at the back of the eye, that's the only place that you can actually see blood vessel changes, and you can magnify everything in the back part of the eye. Do you usually get patients that are similar whenever you're at the office?
Yeah, absolutely. It's funny because when people associate the eyes, what they think about is just the vision component of, oh, I see well, 20/20 vision. I have excellent vision. So haven't been to the eye doctor for like 10 years because I have perfect vision, So I hear that so often, where people think that having good quote unquote vision equals good eye health. And that couldn't be further from the truth.
Mm-hmm.
And like you said, there are so many things that we see systemically that all correlate from the eyes, right? And so when patients come in and we're the first ones to diagnose that they have diabetes, or their blood vascular system looks off in their retina, and so they get further tested and they find out that they could have died, right? Had they not known that their blood pressure was spiked so high that it was emergency type situation with no symptoms, right? And so a lot of people don't realize that you can see a patient who's had a stroke
in the
eyes, right? A patient who's diabetic, hypertensive, has cholesterol, thyroid problems, like a lot of systemic conditions that people don't realize that we can sometimes get to see first before patients are even aware of it.
Yeah, I've seen cancer in the eyes. Actually, just a recent patient. He came in. He's a very healthy guy, and I've been, seeing him for a few years. And then he hadn't come in a little while, and he called, and he was having some symptoms of, something's not right. My vision is still okay, but I know something's not right. And yeah, I found some cancer in the back part of the eye, in the retina. That's the type of cancer that usually spreads. And luckily, we caught it very early on, and he got treated by an eye oncologist. So he just treated the tumor in the back part of the eye, and this is just recent, maybe 2 months ago. And so he's undergoing that. But and then we talked about how a full body MRI was probably going to be a good thing for him to do, and he got checked out, and luckily he's good, and he doesn't have any cancer that has spread anywhere else, like in the lung or the liver, which usually spreads to that particular cancer. But yeah, I mean, I've seen tumors on a 2020 view patient that sees 2020 normal vision. An 8-year-old little girl, she had a tumor in her brain, the size of a lemon. She had 2020 vision.
I remember
And
that.
and also a 45-year-old, which had a tumor. So it's like you can get a lot of eye disease by not knowing that you have anything wrong. So
And most people think that wouldn't you have symptoms or have any other things, or your vision would be impacted, and not necessarily. And sometimes when it elicits and you do have vision loss, that could have been vision loss that could have been saved, right? But it went too long undiagnosed until a patient finally realized that they couldn't see, or had problems. And I think that's a big component. Is people don't associate that so much on the health component. But imagine, like we see a lot of diabetic patients. Diabetic is such a common problem. And most people don't realize the impact it has on, of course, the whole body, but the eyes are some of the most vulnerable ones. And the vision goes really up and down. And sometimes that is the first sign of having vision that goes in and out and is unstable, when their blood sugars go really out of control. And when people lose vision because of hemorrhaging in the retina or permanent damage, it impacts their quality of life. And so it doesn't matter how much money a person has, or if they're ready to now take care of their health and want to do surgery. Sometimes it's too late, right? And so when you imagine losing vision, and one of the most, when they talk about leading causes of blindness that can be preventable, I mean, that is one. That is one of the top ones also. That if we were to get that managed and diagnosed and treated earlier on, before a patient loses their vision and goes blind, I mean, imagine a person's quality of life when they no longer have their sight.
I mean, I saw firsthand a family member, which already passed away. But I had an uncle. He had diabetes. He was not overweight. He was very thin. And his diabetes was not able to be managed. And little by little, he was losing his vision. And for a number of years, he went completely blind, from a little bit of vision loss to, complete vision loss. And then, yeah, the diabetes was, wreaking havoc on him, and it affects, the whole family. And, his family were really good about taking care of him until, the very end. And, but me being a younger, kid, viewing that, that made it one of my missions whenever I became an eye doctor. And I already knew in 5th grade that I wanted to be an eye doctor, right? So, and I think I was probably in college by that time. But I would see him, whenever I would go to his house, and he was not able to see me anymore. But I mean, he remembered who I was, and then his whole system, his whole body started to fail little by little. But that's a very, very tough disease, diabetes, because it takes away little by little, all your organs,
Right.
So, but the vision piece of it, that's what impacted me the most, so that's why we're very, passionate about, if someone comes in with, diabetes or high blood pressure, hypertension, we're educating them.
Right.
We're educating them about diabetes. We're educating them about, nutrition and health. And if they're able to exercise, we're doing, a little bit more. Our examinations are more extensive because of that, right? But then you add the technology piece, and then that's why they keep on coming back, because they're not getting that at most of their, primary care physician, their care. So there's some wonderful primary care physicians, but I think they don't get the right amount of time. They get, their 5 or 10-minute appointment and they're out. They don't get that education piece.
Right. And I think that's so critical, is to tie it all together, right? Because at the end of the day, when you have a patient coming into you, we're not just treating the eyes, right? We're treating the patient as a whole person, as a whole system, so to integrate ocular health and systemic health and all together, how does it tie together for a patient that impacts them as a whole? And what can they do more on the preventative side? And even during side, right, aside from the need of just medication and throwing, a temporary solution to the symptoms, right? How do we go to more of the root issues, right? And yes, medications are needed in certain times, but if we can incorporate lifestyle, health, nutrition, vitamins, resources, or whatever it is that we can integrate, right? So that a patient has more options to optimize their overall health, right? That's what we're into. And it's been a really good beauty of integrating those worlds, because you are so passionate about, longevity of functional medicine, of nutrition and anti-inflammatory, and you yourself practice it. And, you teach me and you teach our patients. And, for the past 18, 19 years, integrating what we've learned in the eye health side, but then more so on also the nutrition side. Patients appreciate that so much. They're like, how come I was never told this before? That I can just have other options, that I didn't have to be on all this meds. And sometimes we look at the list of medications, and when we work with them, and I've seen you firsthand work with patients where they can then improve their overall health and get off on so many different medications because they've improved their health, right?
Yeah, and it's with diabetes, it's not that complicated. It's most diabetes, diabetes type 2, it usually stems from one thing, and that's just what we eat, right? So, but it at the same time is not that simple, because what we're eating now here in the United States, everything's full of toxins, right? The quality of food here in the United States is probably one of the poorest in the whole world. We travel a lot. And the quality of food that they let pass through, all these organizations it doesn't make sense. Actually, it does make sense.
It's money.
It's yeah.
There's a big monetary component.
Yeah. So it's but it makes it very difficult for, the normal person.
He thinks they're doing good.
Yeah.
They're trying to be healthy. And if you read the fine print and all the extra preservatives and extra things that are being done to our food, and it alarmed me when I started looking into documentaries and doing the research, and it's alarming, right? What we put in our system, and we're thinking we're trying to be good, right? And but let's move a little bit off. Let's go back to the eyes for a second, because people, want to see how can they optimize their eyes, right?
Mhm.
And increasing their productivity and everything that we do, right? I think we hammered pretty darn hard on the systemic component, how that associates with the
That
eye.
could probably be
That's
another,
a whole
another
section in
episode.
itself,
It's
right?
because we just need to open our eyes on who exactly benefits from the food, right? It's not you. It's definitely not you. It's the other companies, the food industries, which I think, in my opinion, is probably the most powerful industry here in the United States. That's just my opinion. And then the second
Drugs.
most powerful industry is the drug industry. So, and they throw you back and forth. You get sick from all the bad toxicants, insecticides, pesticides, glyphosate, Roundup, and then you can't manage, your health because you're so inflamed, and your diabetes can't improve because you're so inflamed, and then that makes other hormones, horrible. That increases your stress hormone, and so. But then who's there to save you? Oh, the drug industry, right? So, and some of these, one of the biggest drug industries or drug companies actually manages a lot of these insecticides, right? So the glyphosate, right? So you make the poison, and then they have another arm in their company that's there to try to save you. So it's just about revenue, right? So, and in other parts of the world, you can't really, it's not allowed, a lot of these other things that are going on, here in the United States. It's whenever we go out of town, we lose weight,
It's
and we
funny.
eat so much, and we love to eat, but we lose weight. And then over here, it's very difficult to lose weight, because of all these foods. But, going back to the eyes, right? So
But
in
people
general,
think, well, how does that affect the eyes, right?
yeah.
Because it does. From a symptomatic point, let's just say, as a patient who, say, for instance, quote unquote, you have no health problems, according to the lab test, right?
Mhm.
But most of us, I would say, are on some sort of digital device.
Mhm.
Okay, so we're on the computer a lot, most of us, regardless of what profession or even what age you are. You're on some sort of digital device. When we ask patients of symptoms, right, and we ask them, do you have dry eyes? Do you have allergies? Do you have redness, burning? No, most of them, sometimes yes, sometimes no. They're just like, no, my eyes are just tired.
Mhm.
So that's the number one complaint I usually hear is like, I'm just fatigued. My eyes are just tired, right?
Mhm.
And then we ask a little bit further on, well, okay, well, explain to me, what do you do most of your day? How do you use your eyes? Oh, I work in front of my computer, I'm doing my laptop or whatever most of the day. But by mid-afternoon, my eyes get super heavy. I get super sleepy. I was like, well, does your vision go in and out? Does your vision blur? Oh yeah, it's heavy and it starts getting blurry. And then I look across the room and it's extra blurry. And then I said, well, when you blink a few times and he goes, does that help? I'm like, oh yeah, if I blink, I have to consistently keep blinking because it's so blurry. Um, and then what happens? I was like, what do you do after that? Well, after that, my head starts hurting, right? And so I'm so tired and my eyes are heavy. And then I start looking around, but then it's too blurry when I look across the room. And so I was like, do you use any eye drops or anything like that? Well, yeah, sometimes I'll grab maybe some eye drops. Well, what type of drops do you use? Oh, those over the counter ones. I think it's like Visine or, Clear Eyes or one of those drops. And I'll just use it when my eyes get really tired. I mean, how common is that conversation?
Every day. Every day.
Right?
It's yeah. I mean, I get that, very often, and they try to make it better, right? But again, we're not getting to the root of the problem, right? So the root of the problem is usually not your eyes. The root of the problem is what you're doing, right? So for some people that are doing, because most of the patients I see are doing between 8 to 10 hours of screen time, phone, tablet, iPad, desktop, laptop, right? All together. And so if we can kind of show them, okay, well, if you're able to back up your desktop to 3 feet or 3.5 feet instead of 2 feet, that gives you a big relief, right? Because as our eyes focus far away, they relax. As your eyes get closer, then they strain. Our eyes are meant to look far away, right? So if we would not use the computer or any devices, of course, our eyes would be much more relaxed, right? But that's not realistic. So if you can back up your screen, if you're using a laptop, for example, I would probably kind of like what we have set up here. I would have the laptop and then a big screen and then back it up. I mean, here, how many feet is this? Probably 4.5 feet out. So I'm looking at the screen, but my eyes are much more relaxed. And then I have the window immediately, behind the screen. So I'm looking at, who's passing by, but I'm also looking at my screen. So the more that you look far away, your eyes are going to relax. So one of the reasons why our vision gets worse is because we look up close. So the more up close work we do, usually our vision gets worse faster. Right. So if we give our kids an iPad at 1 year old to make them quiet, more than likely their vision is going to get worse. They're going to get nearsighted so much faster. Mm-hmm. So if you were to keep your kids outdoors more, looking at things far away in the sunlight, their eyes would be so much better.
And there's so much research to back this up.
Yes, and there's double-blind, placebo-controlled trials and all these that took many kids, and the kids that were outdoors even more, they're the ones that their vision was a lot better. It's not even close. So by looking far away, by taking frequent eye breaks, your vision will stay a little bit more stable and it won't get worse faster. So back up the screens, back up your laptop or your desktop. On the phone is a little bit different, right? So if you're holding your phone really close, then that's going to put more eye strain. So back it up a little bit as much as you can. That way your eyes can relax a little bit more.
And if you're 40 or over, that even becomes more pronounced, right? Mm-hmm. Even more pronounced because the lens in your eye gets less elastic over time. And it's like the closer you bring it, the harder it becomes, right?
Yep.
And so that's one of the things at a young age, even when there's not blur per se, distance, ergonomically set up of your laptop, computer, your workspace is one of the things that you can control. And then frequent breaks, like you said, one of the things I tell patients is the 20-20-20 rule. For every 20 seconds, take a 20 minutes. For every 20 minutes, take a 20-second break and look at something across the room for 20 feet out. And so that's something just to and we don't blink as often, right? And so when you look across the room for that 20-second break and just making a conscious effort to blink. Because when we don't blink as often, guess what also happens? Your tear film thins out and your eyes get drier, right? And as your tear film thins out and your eyes get drier, the quality of your vision also gets impacted. Fatigue starts. Dry eye syndrome is such a prevalent condition. And that's why our clinic sees so much. I mean, we do so much dry eye treatments, much more in depth than here's an eye drop and good luck, right? There's so much more, and that's the root of the issue. And sometimes the eye drop is just a Band-Aid, right? It's
Mhm.
just a Band-Aid, not getting to the root of the issue. And I think that's, when people say fatigue, they think it's normal. They think, well, I have to just live with this because that's just how my eyes have always felt.
Mhm.
That's how it's always been, right? And until people get to the point where it's like their eyes are now super red, they're burning, they're having a lot more, do people start getting a lot more serious about it?
Mhm.
But if we can get to the root of it in the beginning, and I have dry eye syndrome ever since in my early 20s,
Mhm.
right? But the good thing is, being an eye doc and having the technology that we have, I get to have all the top line treatments so that I'm able to also, from a patient perspective, not only just from the doctor perspective, be able to explain and explore options with patients. Everyone's lifestyle and type of dry eyes is different. It's
Mhm.
not a cookie cutter approach,
Mhm.
right?
Yeah, with most people don't know that in our eyelid margin, we have 26 to 28 oil glands in each eyelid. So those oil glands work with blinking. So each time you blink, they release a little bit of oil.
Mhm,
And then the oil mixes with your tears.
mhm.
And that prevents the tears from evaporating quickly. So if you're on your phone, you're blinking almost 60% less per minute versus whenever you're not on the phone and you're looking far away. If you're on your laptop or on your desktop, I should say, you're blinking about 50% less per minute. So if you have your desktop a little bit further away, you're going to blink a little bit more. So, and then if you don't blink, then those little oil glands, which the oil should look like clear coconut oil.
Mhm.
And if you don't blink, they get clogged and then they start to become very thick, like melted butter or like a solid, like butter,
Yeah.
And then that's whenever patients get very, very dry eyes.
Right.
So just by working, like what you said, on blinking often, like consciously blinking whenever you're on the screens, that helps out. And then taking frequent eye breaks. And sometimes whenever I'm on the laptop, and if I know I haven't blinked, I just kind of squeeze my eyes 2 or 3 times to force that oil out, right? So my oil glands don't get clogged. But yeah, we treat a ton of dry eyes, and we have four different machines that actually treat the dry eyes, right? To get to the root of the problem, kind of like what you were saying, that clogged oil
But
gland.
we screen every patient for that.
Mm-hmm.
Right? We don't wait till they have symptoms to say, hey, my eyes feel dry or my eyes feel uncomfortable. We screen every single patient so we can diagnose dry eye syndrome before a patient even has, symptoms, and tell them these are your meibomian glands. This is what it should look like. These are what yours look like. This is how much oil production. And when a patient sees and they're like, oh,
Mm-hmm.
right. And they
Well, yeah, I did have dry eyes, not every day, but 4 times a week, for certain hours.
But you learn to tolerate it.
Mhm,
I've
mhm.
learned to, I remember when I didn't do a lot of the treatments and I learned to deal with it. I remember I would have contacts even when I was in optometry school, and my eyes would be so dry in about 3 hours. I mean, I could not keep those contacts in anymore, and I would just not wear anything because I was like, I'd rather just wear glasses than, deal with these. And for the longest time, I just thought I could not be a contact lens wearer. And I just dealt with like, yeah, that's just how my eyes are. And I just have to live with that. Right.
Mhm,
I didn't realize there's so many different types of options, and technology and treatment options for dry eyes have advanced so much
mhm.
now, right? That pharmaceuticals are our last line of treatment.
Yep.
Because,
Because pharmaceuticals don't treat the root of the problem.
exactly. But what gets thrown out there, and gets marketed is always the pharmaceutical things, right?
Mhm,
And so sometimes patients directly come and they just want the prescription for the pharmaceutical. And then we explain and we do all the testing and show them, and they need the education component. And then we do the alternative, and it saves them so much more, and it gets them to the root of the problem without
mhm,
having to spend a few $100s every single month on a pharmaceutical. That's just a temporary band-aid.
mhm. Yeah, and the pharmaceuticals are getting even more expensive. A lot of the insurance companies are
Not
not
covering it
covering
anymore.
it because dry eye disease is so prevalent. I would probably say out of, a typical day, I would say probably 30 to 40% of the patients I see have some form of dry eye. And there's different types of dry eye, but some form of dry eye, usually with symptoms, but some patients, like you said, without symptoms. And the ones without symptoms, a lot of the times, the dry eye has been there so long, the eye becomes desensitized,
Yeah.
right? And then that's whenever it gets into a bigger problem because they don't sense any discomfort or pain anymore. So then they get an infection, an ulceration, and then that's whenever they can start losing, a little bit of vision, right? And they can get some scarring on the front part of the eye of the cornea. So we just have to be a little bit more careful with them. And then there's even like tissues that you can actually place, on the eyes and like stem cells almost. So you place it on the eye, so we can regenerate some of the tissues there. But yeah, we try to not do a lot of those. We try to catch it early. That way we can kind of prevent some of the more invasive treatments.
Right. But to see well, but also to have eyes that feel well,
Hmm.
right? That are comfortable because the productivity of your work is impacted, right? And it does make your whole body tired when your eyes are tired.
Hmm.
And when you talk about like headaches, that's another very common one. People just think that they have to deal with a low grade headache all the time, or they're triggered easier by migraines, right? The visual system is so correlated and integrated that, once that gets improved, a lot of people's headaches get improved,
Hmm.
right?
Hmm.
And so when we talk about like blue light technology, we talk about other things that are incorporated to kind of help minimize, right? A lot of taking care of the vision component. Number one, making sure patients are seeing optimally, right?
Hmm.
Getting the best type of prescription, whether it's glasses or contacts or a combination of both, right? Also treating the surface of the eyes so that to maximize their tear film and making sure that their eyes are not dry or inflamed. Allergies being another big component, especially here in Dallas. In addition to dry eye problems, a lot of our patients have a lot of ocular inflammation because they have bad allergies. And then they're using allergy medications, they're using nasal sprays, which again dry the eyes out even more, right? And then they're on a whole list of other medications, which side effect is also negative on their eyes, right? And so to be able to manage that component, right? So the eyes not only see well, they feel well. But then we also work on a third component that most doctors don't work on is look well,
Hmm. Hmm.
right? Because when patients come in and they chronically have red eyes, or they worry about the bags under their eyes, the lines around their eyes, the puffiness. I mean, that's also the look component. And what's funny about patients is the health component sometimes, yes, they hear it, but the cosmetic component really gets people.
They really hear that.
Oh, I can look younger. Oh, my eyes can look whiter. Oh, they can look more, alert. But it's a combination of the looks, feel, and see, right? All
Hmm.
of it to optimize for a patient, right? Because and that's one of the things that's great in the line of work that we're able to do. And Jaime, when I was first starting out in our practice, I mean, he loves technology. And I've always said in previous episodes, he's always more a visionary and more advanced in all aspects. And these equipment that we purchase in our practices, we probably have more high technology equipment than any other doc I know, right? And we run a lot of these on most patients. Some of them are extra testing for glaucoma or whatnot, but a lot of them we run with no extra charge for patients. And so when a patient comes in, the number one reason they'll come back is the experience and the level of care, right, that we provide, the comprehensive exam that we provide to all patients, regardless if they're private pay, whether they have any type of insurance, right? They get the thorough care. And because you invest so heavily, and at the beginning, I was just like, oh my God, lover, how much do you want to invest in this piece of equipment? They cost so much, right? And most doctors can get the same amount of their exam, whether they have all those extra 3, 4, 5 pieces of extra equipment or not, right? But the level of care could be so much more in depth when you have these extra diagnostic tools for patients. And I appreciate that a whole lot now. Again, I was much more narrow-minded when I was like, oh my God, why do you want to keep investing in so many different type of technology? But it's all to be better prepared and have better options for patients, right?
Yeah, and that's what I would recommend, for people that live, outside of the Dallas area. Seek an eye doctor that's going above and beyond. First of all, that's a lot more technology and continuing education with technology. You want to make sure that they're practicing some sort of kind of functional medicine type of approach, because they're usually going to get to the root of the problem. And instead of just giving you a medication that you'll be managed on, that more than likely you probably won't, improve or get better with, kind of like, manage healthcare now. It's like managed healthcare. They want to manage the patient forever. So we're looking into eye healthcare to getting to the root of the problem. I don't want to put someone in an eye drop that they will always need for the next 40 years. That's $300 to $500 a month. That's just not who we are. We need to get to the root of the problem. I am not part of pharma. It's like, that's a completely different, I don't get paid, by them. I don't have any, association with them. So my duty is to get the patient better or solve their eye disease, right? If that's by, implementing some technology, that's great. If there's something that they can take on a temporary basis, and make them better, that's great. But managing the patient for years and years, that's usually my last option. So there are some eye diseases that you have to, every day you just have to take something. But if there is something available to me out there, I'm going to look into it. I'm going to do my research. I'm going to try it out at these conventions. And if that's going to help the patient, kind of solve their issue, that's what I'm aiming for. That's what we're aiming for, and that's why we have so much technology at our offices, so, and just.
But, technology alone doesn't do the job. The education and integrating it properly is definitely important, because you can have all the technology and the patient can have all the knowledge, but if they don't understand and integrate that into their life, right, to make use of that knowledge and technology, then what's the use? Right.
The education and the implementation,
Absolutely.
Right? So on their part. So again, it's like with eye health, it's almost always about your health in general, because if you are not, say, eating well, if you're eating, like most of Americans now are 70% eating ultra processed food. So 70% of the diet now in the United States is ultra processed food. So ultra processed food causes a lot of issues in our body, right? And one of the issues very common here in the United States is macular degeneration. So by just, knowing that and fixing the diet, getting less inflamed and, having better health, and you don't even have to exercise every day. or you can exercise, just after you eat, for 10 minutes, kind of like
Just
we do,
walking. Yeah, just walking even.
but you can reduce macular degeneration by just eating a lot healthier. And a lot of the eye disease, you can, like dry eye disease, you can actually get much better by just eating healthier, reducing your inflammation. And then,
What's funny, as you're talking about inflammation, we have so many patients come in that we've been seeing for so many years, right? And people think when they think optometry or they think eye doctor, they just think glasses. They think contacts and glasses. And that's pretty much what they assume that we do, right? But patients who have seen us through all these years, the feedback we always get is, oh my gosh, our health as a family have improved, and we've learned more through you guys, right? To help with our overall health and working with, filtering what we need to do, and not just say eat healthier, but actually giving them guidelines and a do not eat and a do eat, and kind of things that works for them. And like I said, it's no cookie cutter approach. Every individual is different, right? But being able to listen and help and work with them as a whole has been something that, it's been very fulfilling for our journey. And some of these patients, it's not like you see once a year. Yes, we recommend, patients to come see once a year, but a lot of these patients, they become like family. And sometimes we'll see them a few times out of the year, right? And they come in and we double check and we, what else is new. And even with dry eye treatment or diabetics or glaucoma, we see these patients more often. And it's not just, hey, run these panel of tests and that's your yearly, quarterly test and you're good to go. It's not like you're not another number, right? We actually review and integrate like how things are working. What do we need to pivot and adjust, right? And it's at the end of the day, it's just taking care of a person as a whole, just like if you would want to be taken care of, right? When we go see our doctor, or we want to, get taken care of. We don't want to feel like here's a checklist, here's the test, run them. Okay, the numbers look good. Bye. We don't run a sick system. We want to run a health system, right? And that's the difference. Is a lot of times we don't go to the doctor until we're sick, right? And and it's tough. And it's the same with eyes. We want to have healthy eyes. We don't want to wait until we have sick eyes to try to then get them healthy. It's a lot easier to keep healthy eyes healthy than to have sick eyes go healthy.
Yeah.
But these are definitely things that, sometimes we just don't think about. And but anything else you can think of for tips to optimize?
So I would say for some of the patients that we see, I'm going to stick with 60% of the population in the United States. That's the majority. Just a fact here. 60% of the US population is pre-diabetic or diabetic. So that's just something that, I heard that fact from one of the government sites. I was blown away that people that don't have diabetes are now, that have diabetes is now the normal here in the United States. So if we were to stick with someone, that comes into our office with diabetes, the number one thing I would say is don't change your whole diet, because that's usually not achievable the first time that you speak with them. I usually tell them, after you eat breakfast, just go walk for 15 minutes. After you eat lunch, go walk for 15 minutes. And after you eat dinner, just walk for 15 minutes. And that's very doable. Take your husband, take your wife, take your kid, take your dog, take your neighbor, take your friend, but by doing that, that's going to reduce your sugar load in your bloodstream by sometimes up to 60% after you eat. There is not a medication out there that does that.
Simply by just walking.
that I know of, So by just walking, that helps with the sugar levels in the bloodstream because your muscles work with sugar. So if they're after you eat, of course, with everyone, there's going to be sugar levels that go up with everyone, right? And if you go out for a walk, then the sugar in the bloodstream, in your, veins in your body, the muscles are going to grab the sugar and then place them in the muscles to use up, right? So they're using up, they're grabbing the sugar and they're putting it in their muscles, right? Because they need to work. So, and sometimes it's up to 60% with some people. And that's just the first step that, we usually say whenever they come, visit us. You don't have to change your diet immediately. We can do that, on another visit after, we take a look at your retina in 3 months to see how you're doing. And let's see how well you implement it. And then once you go see your whoever's diagnosed or managing your diabetes, let's see how your sugar's doing after you get your A1C or your 3-month sugar check, right? And I would say most of the time it gets much better just by doing that. And then we can kind of work with, okay, well, this might be a good thing to kind of start doing. So we can take care of your retina better. Let's try to do this and this, right? But if you give them too many things at once, they're going to do none, right? If you give them one simple thing to do, they usually do really well because that's something very doable. Like, we're in a group that we're doing, we're doing 100, push-ups every day and 150 core, so, and it's, and, that's simple to do for us, because we can spread it out throughout the day. We can do 20 here, we can do 20 here, 20 here. But that's something you can see the change in someone's body in 1 month, right? Very, very easily. So that's something that we do with diabetics there. And, there are many other eye diseases, but, like we talked about, the screens it's another big one, work on the screens for those people. And I mean, there's even, eye drops that help with cataracts now, kind of to help with cataracts. And now there's oral medications or supplements, I should say, that help with, macular degeneration. There are great vitamins that we recommend our patients, for that.
And even better quality, different type of quality eye drops, even if a patient has to have eye drops to help, right? Because like I said, everyone's dry eyes is not equal, right? And so one product doesn't work across the board the same for one patient versus another. And so having proper evaluation of a patient's oil glands and tear film and the type of dry eyes and severity puts a better plan in place for them and the type of products to use and the regimen, right? And most people, if you give them a good regimen, and especially if they can feel and see the results, right, it's more sustainable than just telling them to go to the store and just buy any rewetting drop, because you go to the drugstore and you see tons of over-the-counter drops, and sometimes we don't know the difference between the different eye drops. Most patients have no idea what the difference between that eye drop versus that eye drop is, right? Besides the marketing that's done on it.
Yeah, that's right.
So the product that gets best marketed gets most used.
That's right. And here in the United States, I think we're one out of 2 countries in the world that we can actually promote drugs on TV, like Ozempic or whatever you want to promote. No other country besides, I think, New Zealand and us, we can actually promote drugs. So you see how powerful the drug industry is here. So that's just one example. So, but, and then you see at the very end of the commercial, it can lead to stroke, it can lead to death, it can lead to these other diseases by using this drug. So, but that's really not going to stop the patient from wanting to cure their disease, right? So
yeah, it's when we talk about pharmaceuticals, to have it as an option um in the toolbox, right? Not to say that should be the first go to, right?
mhm,
But to have options there, but patients sometimes just want a quick fix.
mhm,
I want to I don't want to change my habits. Just give me a quick fix but they don't realize the long-term negative effects
mhm,
that medication then now just induced a whole bunch of other problems that they now have to have another medication to help with the side effects that caused from that medication. And they have to have another, and it's a domino effect.
yep,
Right. And then when you can clean and adjust things and patients feel so much better. And I have seen over the years when a patient gets so lack of energy, right? And because they're just masking everything and they don't know because they see 5 different specialists, right? And no one works with anybody. It's not an integrated health system, right?
mhm,
You go to this specialist, they give you medication because you went and complained about that problem. You go
mhm,
to another doctor because now you have a problem with this one, not realizing that a lot of these things were all side effects from the medications that they were taking.
yep,
And so when somebody takes the time to clean up and kind of integrate and from a holistic point of view, what are all the things you're doing? What are the things we can do to work on the lifestyle things? What can we adjust accordingly? And then finally get a patient cleaned up. And I've had some like this that have some drastic changes through the years. And I'm like, wow, how did all of that? And it says it stemmed because you gave me that education and I went and talked to my different specialists so that we can all work to freaking together and figure out my health problem instead of saying, oh, I just have an autoimmune condition and I just have to take all these medications for life. And I've been seeing this patient for 18 years and she looks freaking phenomenal. They cut her medication list down to probably 3 now. She was on 20.
dang,
Oh my gosh. She's like her life and her energy. And like she's like a totally different person. She
mhm,
goes, I didn't realize like all of that. Once I got cleaned up, and it took me about a year to clean everything up and for them to taper down my medication and get me figure out what I can cut off and everything. And I put in my work, like she was willing to put in the work. Sometimes patients don't put in the work and it's on them. But she was willing and she was like, I spent so much money, seen so many different specialists, and I was just so sick up and tired. She's 52 years old,
mhm,
and then now, and she's like, she's full of life. She lost probably about 70 pounds, right? Got off of 17 medications, and all her numbers look so much better now. And I'm like, man. So, yeah, is it possible? But yeah, but you just have to have a team of doctors who are willing to work together, right? And not just throw another temporary solution. And patients, a lot of them, patients are getting a lot more savvy. They're getting out there. They want to improve their health. They realize how much it's impacting, but there's so much mixed information. And I mean, it's confusing what's good or what's not, or what should I do, or it's crazy, right? And so, but just to see patients coming back and then having a total change in view of life, because when a health changes, it's not just the physical health. I mean, the mental, the emotional, and the overlay and the impact it has on all the circle of their people, in their families and relationship, like it's a whole domino effect,
mhm,
right? And so, and because I've been able to see her for so long and I've seen her journey, it's like, it's just really heartwarming. And the more and more I see results like that, the more it just motivates and fulfills us, right? To be able to spend that time with patients. I mean, everybody wants to increase, when we go to a lot of our practice management courses on business, it's always increase the number of people.
mhm,
It's always just more doctors, more patients per hour, right?
mhm,
But for us, through 18 years, we've never increased the patients per hour, right?
Mhm.
We've always just improved the quality of care per patient because we value the education and time component with each person,
Mhm.
right? And patients really appreciate that
Mhm.
because it's not just another number. Like, how much can you really do in 5 minutes or 10 minutes to be like, okay, here's a prescription, here's your good to go, right? I'll see you next year.
Mhm. You were talking about savvy patients, and I've known this particular person for a long, long time, and they had going back to diabetes, and they had an 11.6 A1C, which is extremely high, and so normal, it's like less than 5.6, right? And so 11.6, and the physician was telling him, you need to be on this medication, and come see me back in 3 months or whatever. And whenever they got the blood work test, they came, and then we saw some retinal changes in his eyes, and they were starting to hemorrhage a little bit in the back part. So we kind of talked about it, and we came up with the game plan. And in 3 months, he went from 11.6 to 6.0, and without any medication, just by doing a few things that we talked about. And so he went he went back to his physician, uh, and his doctor was extremely upset at him why he didn't take any of the medication, and he had lowered his A1C, his glucose number, so much better in 3 months. And he told him, if you're not gonna follow all my instructions and medications that I prescribed you, I'm not gonna have you as my patient.
Oh my
And
goodness.
instead of, that is remarkable.
Exactly.
I have myself, I have that is very difficult to see someone go from 11.6 to 6.0 in 3 months,
Absolutely.
and I couldn't be happier for him. you know,
Right.
and of course his retina improved in 3 months. There was less bleeding in the back part of the eye. And but I that's the system that we're in, right? So it's like, you have to get to the root of the problem, and what
But
is
you,
it?
you but I can't really blame even doctors because that's the education system. I mean, as doctors, and we have doctors in the family. We ourselves through our own journey, our education, and in the medical side, and it's heavy on pharmaceuticals, right? It's
but
pharmacology, and
but you're doing, say, just me as an example, my opinion, 100%, we're doing a disservice to the patient if we don't
absolutely,
continue to learn, right?
absolutely, you have to
And
continue to learn.
some doctors don't want to do that. They don't want to continue to expand their knowledge, what other options are available, because they are stuck in the system, so and I'm all about learning, and the visionary part of me, it's like, how can we improve this? How can we improve that?
Right,
How can we help the patient even more? Right? Because I've seen it firsthand,
right.
with so many patients. So, but yeah, it's like you have to seek a second opinion, right? So a lot of the times, so it's now it's you're seen for 5 minutes, and then you're told to do something, and then most of the time, the patient doesn't question it. But I would just recommend a second opinion. Let's see what another person says. So, because you might have to take it for so many years or so many months, and
Right.
just set second opinions. And this is not medical advice for the people out there. Of course, we're just talking from experience from our patients, right? um, but it's and that's what's if someone comes to me and say, hey, I have this condition, and I tell them, what my opinion is,
Right.
and then they go seek a second opinion, and then they come back to me. That's okay. The
Right.
patient, I understand that the patient wants to learn more. They want to get more educated, right? Which is a great thing.
And
But
it is.
but people get very upset. Doctors get very upset at that.
No, I always encourage, you are in charge of your own health, right?
Mhm.
The doctor can do the testing, give you the diagnosis, give you the recommendation of treatment, but it's, your body best. And you also have you should be able to freely explore other options and talk to other healthcare professionals for a second opinion. And if another doctor doesn't like that, then they may not be the right fit, because at the end of the day, your overall health, it should be the priority,
Mhm.
right? And for you to get educated better, for you to have a network of doctors who want to take the best care of you is what you should be seeking. In my younger years, I made the mistake of just taking it as face value, whatever the doctor recommended. I never questioned it, right? And I took their advice and just stuck it out. And I knew in my own body that I should have listened to my own intuition to get a second opinion. But I figured that this is their expertise. I go to them and I trust them. So whatever they recommend to me is what I will listen to, and I went against my own intuition and gut feeling of going and getting, until I really stood firm on my grounds. And, I could have saved myself years of pain,
Mhm.
right? Had I seeked another opinion. But you just, that's why I've learned the hard way. But now I was like, no, even when patients come to us and we give them a diagnosis or a treatment plan, and if they want to seek a second opinion, we encourage it and we're okay with that. And if they want to come back, great, and we work with them. So we don't get upset at people like, if you don't listen to me, then go somewhere else, But I think we're wrapping up the hour, lover.
Anything you're most excited about in eye care, or in the future for our podcast?
Always, because our podcast, you get so many different topics, for eye care itself. I mentioned in my early 20s about not being able to wear contacts for 3 hours. And, since I've been able to get treated, and we did the LipiFlow on me, and I've had plugs in ever since optometry school, but the LipiFlow was one of the biggest things that really helped me.
Mhm.
Right. And I wear contacts full time because people used to see me not wear my contacts, and I didn't really like to wear glasses as much, and I would only use them when I was driving at night. But it was funny because ever since I was able to wear contacts, I forget now that I have dry eyes, because I forget that they're even in there.
Mhm.
Right. And so that's always been very interesting and exciting, because I'm like, wow, the world of dry eye treatment has really advanced so much. Right. The other thing I'm so excited about is now with our eyewear, it's always new styles. And so Jaime is always like the walking model for our eyewear collections. And so they're always like, well, where did you get those? Right. And so a lot of our patients, I mean, we see people of all walks of life, and our eyewear collections are really unique, and so they will always spot someone if they're in the DFW area and they're like, oh man, those really stand out. Where'd you get those? More than likely they come from Eyepieces, right? And so they're always like, yeah, we recommend and refer patients to you because we don't have the cookie cutter eyewear glasses collections. And Athena launching her collection this year, the Athena eyewear collection that we custom did, was super, super exciting, right? And so people are always like, oh, I heard you have the Athena eyewear collection. Can I see those now? What else is exciting? Oh, we have visual fields now that are like in a virtual reality game. Patients love that, instead of the old big dark room, so people are like, what is that? That is so cool. So it's a lot of cool things. I think, I forget that we've been practicing almost 19 years now. And some of these patients we've seen from all our previous practices before we even had our own, that just follow us through the years. Right. And so even though people know us now more in the real estate space and speaking space, and, Obviously, we're still doctors. We still have a passion to practice and see patients, even if it is part-time, right? But I mean, we love it. I come in and, I'm glad that I don't have to do a lot of the nitty-gritty in the practice as much as I used to, right? And we have great teams, but I love still the patient component and the one-to-one and everything I'm learning in personal development, anything I'm learning in nutrition, anything I'm learning out there, I incorporate that in my sessions. So patients come in for their eye exam and they're getting like all these other things now. And they're like, oh my God, I just want to come in and have the 30 minutes with you. Because they get so much more life advice on all different aspects, right?
Yes. Our eye examinations are getting longer and longer. So it's like patients have to wait a little bit more.
We talk about everything, whether it's food, whether it's travel, whether it's health, whether it's eyes, whether it's family, I mean, it's just so many different components because like at the end of the day, we're just building relationships, right?
Yeah.
And so it's been fun. It's been a fun journey, but thank you for joining in and listening on this episode. We don't know what we're going to talk about next. You will find out as we're coming forward as well. But always, if you have any ideas or suggestions, we always would love to listen.
And thank you for the person that recommended, talk about, or the couple people that recommended talk about eye care. So that's something that, again, we're very passionate about. And we are here, hopefully, if we're not traveling, Mondays at 11 a.m. Central Time. Did you like today's topic?
I did.
Awesome.
I did.
I did too. Thank you so much, everyone. Have a wonderful week.
Bye, everyone.